Thank you, Mr. President. I rise today to speak against this bill because it targets something important to me and to my constituents. I'm talking about women. I'm talking about reproductive rights, but more importantly, I'm talking about something more basic. This bill, SB 456, is really about access. Access to health care has been a problem for a long time in Georgia. We've talked about this a lot in this chamber. We've talked about it so much that you probably already know that half of our 159 counties in Georgia have no OB physicians. More than 40 counties have no one who does women's reproductive health in their county. And then on the flip side, we've also done nothing to help, to protect and help women's access to health care. We've failed to fully expand Medicaid. We've failed to establish any kind of meaningful parental leave. We've failed to provide a pathway for community midwives. And we've taken no steps to save our rural hospitals. Without access, there can be no equity in health care for women. Let me be clear, the intended outcome of this bill is to limit abortion access in Georgia with the hope that fewer women will be able to access their constitutional rights. Constitutional rights. And what's really cruel about this bill is that those who are already the most vulnerable are the ones who are most likely to be burned by this injustice. People who are poor, people who live in rural communities, people with disabilities, and people of color. The pandemic has made it abundantly clear that telehealth is an important resource for all Georgians. And it's especially important for people with disabilities. Telemedicine is critical for people who may not be able to easily leave their homes to travel to a clinic. Protecting access to abortion via telemedicine is a matter of ensuring that abortion access isn't just for able-bodied people. Telemedicine is able to alleviate the many barriers like cost and distance to clinics, barriers like lack of transportation or childcare. With telemedicine for abortion, maternal mortality rates may improve. And this would be particularly important for Black people in Georgia who are 3 times more likely to die during childbirth than white people. Here's why this matters. When access decreases, the risk of dangerous, self-managed abortion increases. I simply don't believe that we should be supporting legislation in this chamber that purports to know better than doctors and the FDA about what is safe or isn't safe when it comes to women's health. My colleagues, we all know that access matters. In fact, we heard a great deal yesterday about how important it was for people to be able to exercise their legal and constitutionally protected rights without interference or unnecessary delays. And so today, all we are asking is that you leave the law the way it stands and allow access via telehealth to remain available to all those who need it. I yield the well.